Welcome to MMC's Healthcare homepage. In this section of our website, we are going to discuss the 4 P's of the current healthcare business model and introduce a fast-growing new model which is far superior to that of the past. 1. Problem. We are going to identify healthcare's current business model's problems. 2. Promise. We are going to share with you the fundamental principles of a new, proven and tested in other industries, business model that will bring affordable healthcare to the masses while maximizing the earning potential for the physician and/or healthcare provider. 3. Proof. We are going to prove to you there is a far superior business model available for the healthcare industry. 4. Process. We are going to walk you through a step-by-step process on how to decrease your patient load and increase your earning potential. Problem. Patients are looking for new alternatives to conventional insurance plans and are learning they can abandon the previous antiquated system of relying on insurance companies and government programs for regulated care to a more forward-thinking, practical, and affordable model which consists of a membership-based primary and preventive care program. Healthcare, primary care, elective care, preventive care, etc. providers are looking for a safe way to stay profitable, provide unparalleled care and service, and minimize their patient load. Healthcare and elective care providers are stepping out of the mainstream business model and looking for new solutions. Concierge and direct care providers are just 2 of the latest examples of healthcare providers successfully transitioning into the membership-based model. Doctors, hospitals, and clinics are learning they can abandon the previous model of relying on insurance companies and government subsidies for payment and regulated care to a more forward-thinking business model based on membership. With the membership patient model, you can lighten your patient load, earn more revenue, and provide unparalleled care you customize for your patients' members. Catastrophic insurance plans are far less expensive to maintain, but carry huge deductibles, hence scaring patients away from them. By becoming a member of their primary and preventive care provider's patient list, they are able to insure themselves for minor medical care covered under their low-cost monthly membership and have insurance, low monthly payments in case of a more serious, expensive medical scenario. The most challenging and scariest aspect of this move for physicians is not knowing how they will acquire the necessary patients to sustain their business practice under this model. Promise. Healthcare's business model is in need of an overhaul, but overhauling the entire healthcare industry's model is not necessary. The focus should be only on overhauling the business model so it presents healthcare as more affordable for the masses while ensuring the physicians and/or healthcare providers do not sacrifice their income but in fact maximize their earning potential. The biggest fear of all is always, what if? What if it doesn't work? Which is a completely natural fear. In fact, other industries like fitness and golf experience the same fears when presented with a similar business model. But once the businesses from those industries partnered with MMC, they experienced an increase in revenue with an average of $150,000 within the first 60 days in immediate cash, and increased their annual income by as much as 300%. The most difficult hurdle of this healthcare business model is getting beyond the fear between your ears. MMC has brought affordable golf and affordable health and fitness to hundreds of thousands of consumers and has captured the hard-to-reach market for our partnering clients since 1991. There is no company better qualified to grow the healthcare industry and your practice under this healthcare business model than MMC. MMC is guerrilla healthcare marketing on steroids. Proof: MMC has been providing affordable golf and affordable health and fitness to the elusive market since 1991. MMC has thrived while all other companies and concepts have failed miserably in their attempts to acquire the members/customers, health clubs, and golf courses are so desperately trying to target. Example given: couch potatoes and the deconditioned market, as well as the casual and non-golfer. That is the uncommitted market with expendable income. MMC is the only logical choice to be the go-to marketing company for growing this new healthcare business model. That is the ideal demographic, children through the ages of 33, to offset the impending cost of caring for the baby boomers, the elderly, while providing the healthcare professionals with a respectable income. The concept of affordable healthcare that is targeting children and young adults up to the ages of 33, the millennials, who rarely ever need healthcare services to offset the cost of caring for those patients in the age group of 65 plus whom will need constant care, is actually a very logical concept and is definitely a plausible model which can work. In fact, MMC has developed a very similar business model for the health club industry in the late 80s to save the health club industry from an impending death due to too many health clubs, fitness centers, and gyms, and not enough fitness conscientious prospects. The health and fitness industry failed to learn how to market to the most important markets, that is, couch potatoes and the deconditioned. MMC then adapted the same concept to save the golf industry in 2005, which was also overbuilt in the 90s, which again put too much inventory, places to golf, in the market while failing to grow the game by engaging the youth, female golfers, and other demographics.